If you have obvious veins popping out of your body and you've always had it since you were young, then you may consider yourself to be a veiny person. Well, I decided to divide it into 3 further groups when it comes to a person that is veiny. The first group would be a person that has fair skin, and essentially they're almost transparent and you can see everything. They got these green vessels in their legs, their arms, their hands, sometimes even around their abdomen, and essentially they hate it because you can see everything. But sometimes they also have these little vessels that are a little bit bigger and thicker and pop out, and maybe speckled with a bit of red and a bit of purple, and these are spider veins and reticular veins. These veins can be treated if they're abnormal, but for the normal veins, it's probably best not to treat them because you can get more spider veins. Next, we move on to the next group, being the bodybuilders and the super fit people who work out a lot and pump their muscles hard. Now, when you do that because of the increased demand for the muscles, you may find that you get lots of veins in that area. I do remember actually seeing a picture of someone whereby they had these big bulgy veins on their arms, but they were really squiggly and very erratic. And those veins are actually abnormal. So you can actually get a mixture of abnormal veins with normal veins. And oftentimes the only way you can actually tell the difference is actually to get an ultrasound to find out exactly which one's normal and abnormal. It can be a little bit tricky. And finally, we have that patient or person who has veins that are evident all the time. And unfortunately for these people, it can be very embarrassing because they look like bodybuilders, but the reality is genetically their makeup is such that you can see every vein. They almost have no subcutaneous fat, and so you see veins in their neck, veins in their shoulder, veins on their arms, veins on their legs. It's hard for them, especially if they're a woman, to wear short sleeve tops because most people think they're marathon runners or muscle bodybuilders because they look almost ripped with no subcutaneous fat. Now, those are sort of the 3 types of groups that I find that are quite veiny, and I'm sure there are many people out there that fit under one of these categories.